I think that there is probably a happy medium between hard work and taking care of yourself that we haven't figured out yet.
Thanks for watching Hot Flashes and Cool Topics podcast. Be sure to subscribe and ring that bell to catch all of our conversations. Now, on to the show.
Welcome back to Hot Flashes and Cool Topics. Today, we are going to talk about finding humanity in medicine with Dr. Jessi Gold. Welcome to the show.
Thank you for having me.
Well, we read your book, How Do You Feel? One Doctor's Search for Humanity in Medicine. And the book is really talking about a time in the pandemic where you were seeing patients Zoom, a lot of healthcare staff that were really struggling with a lot of different issues, but really separating life from what was happening during that time of COVID. And it really was so poignant in the book when you would talk about your own personal journey, because you were so busy taking care of patients that you weren't really taking care of yourself. And I think for us, we hear a lot from our listeners that obviously that the medical field, that the medical world is just completely upside down. They don't feel seen. They don't feel heard. And I think we forget sometimes that doctors are also human and that they come with a whole history of whether it's mental health issues or personal issues. So I thought I would start with saying, what has the response been since you wrote the book?
Oh, you just said so many really important things, but I will think about the first question first because I want to make sure I actually answer what you want me to. But I think it's interesting. I think people who are in healthcare, it can be mixed when we talk about this stuff. So I think that there are people who are like, thank you for talking about this. It's brave, which to me, I don't love because I'm like, it shouldn't be brave. It should be boring. Like it should be that all of us are talking about this and I'm just another voice. I'm not like the voice or the person who chose to like rip the Band-Aid off and be the person talking about it. So I find that like personally a little hard to land, even though it's the nice feedback. Then there's some feedback that we shouldn't be talking about this stuff, that our job is just to take care of other people, that it's sort of like opening up stuff to the public that we barely talk about with ourselves. I think sometimes the feedback can be kind of clearly linked to maybe what somebody's pandemic experience was and how they react to certain things in the book. I think from patients, for the most part, the ones that have found it, and I hope more people find it from listening to this and other things, because it wasn't written solely for healthcare workers or anything. Like, I really wrote it for what you're talking about, which is like, we kind of fight club through our jobs and don't talk about it and don't talk about it with patients. So what you see could be a disinterested, not as connected human, and it might have absolutely nothing to do with you. And you might see a provider who doesn't ask you about your mental health because they're not dealing with their mental health, but you would have no idea, right? So like having the ability to sort of like connect this to people's lives and what you see when you show up in the office, or why, even as a healthcare worker, you might not have like the easiest time explaining your symptoms to another doctor and still end up in my office. Kind of throwing all of that together. I think the patient folks who have read it have felt like they want to give their providers like a thank you or a hug a little bit more than they might have, or, makes them think a little bit differently about some of their own experiences. And I think it's not to invalidate their experience, because I think that all those experiences and what you feel when you're in the office is true and valid. I think it just gives like a sort of different perspective to where it might be coming from. And it might not just be that they're bad people or they don't care or they are not listening or whatever it is, that there's much more to it,
Yeah, that one thing that really stood out to me, and I always suspected it, but I didn't know, was how much are people in the medical field were told, oh, you have to keep things to yourself. You can't get too involved with your patient. And when you said, hey, this is me, or this, I'm just kind of like this, I'm a funny person, and how much people like you would be criticized for doing that. And I mean, and I know it's a personal choice of what an individual patient. I prefer to get to know my doctor a little
Yeah.
or my medical professional a little. But Can you talk about how that happens in the medical field?
Yeah, I mean, so we're like self-selected as people who care about people, but also people who are competitive. And so we're in an environment that there are not a lot of slots, or we're competing for a spot, or we have to have high X, Y, or Z to get there. So that already is excluding certain people. I remember, being somebody in college kind of paying attention to what people didn't make it through pre-med classes and being like, oh gosh, those were amazing humans who would have been such good doctors, but what we're doing as like the ways to get there are also preventing some of those people. So there's a weed out process that might weed out unnecessarily some of the people who might be better. And then when you go to med school, you don't want to stand out for reasons that would make you look weak or look like you have some sort of emotional problem that other people can prey on, or be something that people give you negative feedback for. So you like do something and you get feedback and you alter, or you watch and see how other people do things and learn. So we call that like the hidden curriculum, like kind of not what's formally taught in a class, but what you see and what you experience. And so what we see around us is not people sharing, and what we see around us, like even in small groups with us, like let alone with patients, and then what we experience is like we'll be in a clinic and we'll ask a question about the patient that's not about their, whatever we're supposed to ask, and we'll get not in front of the patient, hopefully, but afterwards in writing or in feedback, like you shouldn't have done that, you have bad boundaries, or why would you ask that, or that's not what we're here for, or don't make it about you, or anything like that. And so what you start to hear is like, to do this, I can't do that. And so I better figure out like how to do that, because I don't want bad evaluations and I want to get into a residency and I want to, do all of the things I came here to do. And so you sort of lose yourself in that more than I think you realize. Like, I don't know that if you would have asked me in med school that I would have known that I was sort of shifting a little bit to conform because I was not liking the stuff people were saying about me, or like what I was getting as feedback. And I was just like, I think the way to survive this is like put my head down and do what they want. And that's not great. But when you do that for a lot of years, that like by the time that you're practicing yourself, you believe it. Like you forget that somebody told you that and that they like kind of wore that out of you. You sort of go, this is how you practice medicine, and this is how you're a nurse, and this is how you're a doctor, and this is how you show up. And so you just think that you're doing what's right or what everyone else was doing, and in that context like really do like lose that part of you that might have been different, I think.
Right. And you had a great example in the book, and I know you changed the names
Yeah.
the patients, but it was it Megan, the physician, the doctor that came back to get her. I mean, if you could share just a little bit about how that came back to get her.
Do you mean like which particular
Oh, I
story?
would say just how she, was so like, I don't know, kind of blank and not feeling. And then she said I hadn't cried in, was
Oh,
it
yeah,
10
yeah,
years or something
yeah.
like that?
So,
Yeah.
yeah, we do this sort of like, it's also self-protective, right? So there's a lot of bad stuff that we see in here. And in order to not feel all of that, we do sort of like have this armor that's self-protective that is necessary. But it becomes pretty extreme for a lot of folks. So the Megan case, the is an ER doctor, and the stuff you see in the ER is pretty traumatic. And you get to the point where, like, you tell stories over dinner and other people are crying, and you're like, wait a second, like, was that traumatic? And the way I think about this too is like there was that football player who coded on the field, and everyone was like, oh my gosh, what is that? Like, that's the most traumatic thing I've ever seen. And all the healthcare workers on social media were like, is that traumatic? Like, that watching that is traumatic. We saw 10 of those yesterday, right? Like, we have no idea. Like, we basically are numb to a lot of the things that like of course would make other people feel. And so in doing that, you are really protecting yourself, but we shouldn't do it all the time. But we do it so much that like you don't realize that you haven't had emotions in 10 years. And then you come to my office and cry. Like, I would say the most common thing for someone who finally shows up to see me would be like sort of what happens to her, which is just like saying hi and crying and having no clue why, and also being very confused because you haven't cried in a really long time, and being very embarrassed because we apologize for big emotions, especially women, but all people really do for different reasons. Like, big emotions scare people. I don't want to put that on you, like, etc. And for me, I try to sort of say everybody does that in here, but I think that it makes sense that like finally having a space that is for you to share or is about you and no one else might make you almost like overwhelmed to the point that you have emotion just by simply like existing in a space that asked you about you, right? And I think that's what happens in a lot of these situations.
Well, what I thought was interesting was that, you say in the book that expectations chokes off room for anyone's humanity. And that's kind of what you're talking about going through med school, that you weren't allowed to really share those emotions because they weren't considered beneficial to the program. You weren't going to get ahead. And I remember I went to law school and a lot of that was the same thing. You weren't supposed to show empathy, you were just supposed to read the law. And I always felt that that took something away from clients because clients benefited from knowing that you have a human interest in what you're doing. It seems like from our experiences that we go into the doctor's office and doctors are so busy just typing in the computer now, which is different than when we were, 15, 20 years ago. Well, at least they looked you in the eye. Now, some of them don't even look you in the eye to connect on a human level. Is there anything when they come into your office, do they acknowledge that they're doing that? Do they find a disconnect, or is it just something that is part of our normal now?
I think both. So I think there will be people who don't love that, who wish that they didn't have to document in their 15-minute visit. But if they don't, they would be up until 4 a.m. doing it, and there's no other way. And that's one of the reasons why something like paperwork has become such a big burden for people in healthcare. And when you look at the data, like the people doing electronic medical record notes and messaging into the evening are like more likely to be burnt out. They're also more likely to be women because women also tend to have more complex cases that require more like longer notes. We also write longer notes. Like, some of this stuff is just like we're set up to fail in that situation. But, I think that we like inherently wish that wasn't what was going on, but there's nothing else to do. And then you do it so much that you stop apologizing for it, or you stop setting the stage around it. So you forget that like a new patient might not know what you're doing and might not understand why you're doing it, right? And so you are just so used to doing it that it's just what you do. I think the younger folks, as they come up, are not like, they text, they don't even talk to people. So I think that that generation is going to have a very different view of that being not okay, or that being something to explain, because they just think that you look at a screen and that's all you do with people. And so I think that that'll be interesting. But for the current generation, I also think, and I joke a lot that medicine's a bit like Fight Club. Like, for some reason, we don't want to like admit like what's wrong with it, even though it's not my fault that they gave me 15 minutes to see you, right? Like, if I came to you and I said, it's so lovely to meet you, I wish that I can look at you and not take notes on a computer right now. However, I have 15 minutes to see you. And if I don't type some of this stuff down, it will never be typed down. And then I will be doing this into the night and I won't be a good mother. Like, if I said any of that, you would go, well, of course they're typing. But instead, like, we just kind of go hi and go right to the thing, because even explaining that feels like a burden, and we don't want to be apologizing. But really, we're not apologizing for ourselves, we're apologizing for a broken system. And so I think that if you're not well versed in healthcare, it looks like you don't care, but most of us really do care. And if we even just like for a second pause to blame the actual problem, which is the system and not you, like, I do think that there's a common sort of dislike of that patients could understand. Because then if I'm cutting you off from a long emotional story, I'll be like, remember how I only have 15 minutes? And you go, oh yeah, so stupid, of course, like, hold on, let me get to the point, right? Like, it's like you're on the same team instead of like we have a secret we're not talking about. You are mad at us for what we're doing. And then we never actually like ever blame the actual problem, which is not any of the people in the room. It's insurance companies. It's like sort of the push in healthcare to have a certain amount of money made every like time you see someone, et cetera. And that's nothing to do with the person who's doing the work in the room. In fact, if we had a choice, we'd spend all of our time with people. Like if we did redesign the system and they let us, we would not have 15-minute visits. That's a joke, you know? So I wish we talked more openly about some of that stuff. And like I encourage, like when I talk to healthcare workers about a lot of this, I try to encourage that degree of vulnerability, which isn't necessarily like what you would get from me in the book, right? But is a bit like, this is hard for me, but I have to do it anyway. And I hope you understand that it has nothing to do with how I care about you as a human. And it isn't me ignoring you. It is what I was dealt. And I have to do this, you know? I
Right.
think people would understand it a lot more.
Yeah, I mean that it's funny. I was going to ask about the system, the whole system, because you go in, you only have this amount of time and you have to see so many patients a day. And it's just, it's crazy. And, I was thinking about some of the people that you included in the book as well and the amount of pressure they are under. Naya, the medical student. I mean, oh my gosh, I felt so badly for her. She was trying to take the MCAT and she had these situations. You could tell how they wouldn't let her take the test because she was late.
Yeah.
And it just on top of everything else. And then you had the male patient that,
Luke.
uh, yeah, had to leave his residency for a while. And then there's the pressure there. That was another thing too, where, and I don't think this happens just in the medical world, but I think it happens in any profession. When people want to seek mental health help, the stigma that goes along with it. Can you talk about how that is such an issue?
Yeah, I mean, and maybe it surprises people a little that people in healthcare stigmatize mental health, but maybe it doesn't because you've been in a situation where you wanted to talk about mental health and you didn't feel like the person who was treating you was that comfortable with it, and some of that comes from that, and some of that comes from the fact that if you asked me about how to suture, I wouldn't be comfortable either. It is an actual skill set that I went to 4 extra years to learn about. So the fact that a surgeon is less comfortable with it should make sense, not just what made a surgeon go into surgery, but so much else there, right? And so, you know, like if you look at studies, like med students that come in don't actually think that like mental health is something to hide. But if you ask them what everyone else thinks, they worry. So they worry like, will my colleagues judge me for it? Will my supervisors judge me for it? Will my residency applications be judged for it? Will patients judge me for it? And because of all of those layers of fear and what you see modeled and what you hear, people don't talk about it when they get help. So it becomes sort of like a self-perpetuating cycle of like, of course, some of us are getting help, but we're not talking about it because we were told not to talk about it. Because if we talk about it, people will judge us for it. Then we also see like examples where, like, to take time off work, you have to be like actively hemorrhaging or hospitalized or whatever, right? And if the bar for taking time off is like that, mental health doesn't even like hit the radar because you don't see it for the most part. We aren't like really able to like articulate what it's doing to our day-to-day life that well usually. And by the time we're pretty well off, like pretty bad at that point, but still not actively hemorrhaging, right? And so also like it doesn't really fit in the what counts degree. And so if it doesn't count and there's all this fear of what everyone else thinks about it, like hiding it makes a lot of sense. And there's added fears, which I'm sure like as lawyers too, about licensure and whether the licenses are going to ask you questions that are really actually illegal. And you guys could make that argument better than me, but like like really legally they're only allowed to ask about current impairment due to the Americans with Disabilities Act, but a lot of these states are still asking things that are sort of like, have you ever been in therapy, right? Like that's an absurd question. And if you know that that's in existence, you might hesitate to go talk to someone to go ask for help because they're going to take your license for it. And like, it's very unclear what they do with those answers. For the most part, if you went to therapy, they're not going to do anything about your license, but no one's ever said that, right? Like, no one's ever said, we asked those questions for this reason, we use them in this way. Just because you ask for help does not mean that we're going to take your license. But the existence of those questions and an underlying lore of like, oh my goodness, I know someone who checked the box and then they were followed around for the rest of their career makes people really hesitant. And we've made a lot of strides, particularly over the pandemic, particularly thanks to an organization called the Dr. Lorna Breen Heroes Foundation, to change, like, not just state by state, because we have to do it that way, but to also change credentialing in different hospital systems, because that's just another layer of the same kind of questions. Like, there's a big push with a significant amount of impact and change around that. But even that has been sort of recent, and no one knows if they don't talk about it. And so again, the lore is like, don't do it, don't do it, don't do it. They're going to take your license. And you gave up like 10 years of your life to go to school, all your money, your entire identity. You have no hobbies. All your friends have money. Like, it's, it's a lot to then just like lose. I mean, it's the same with sort of like Luke's decision to step back at all. Like, it's the same thing. It's like, what, like, I have to do what to take care of myself? Like, I can't do that. Like, I already gave up like so much to be here. I don't really know who I am if that's not what I'm doing, but also, could I lose it? Like, that's really scary. And I think in the context of all that, we forget like you could lose it because you're ill, like because you made a mistake, because you stayed until it was too late. And like, we're so scared that we don't ask when we should, and we end up waiting so long that for the most part, most of my patients say something like, I haven't hurt anyone yet when they're in my office. Like, that's a terrible thing to say. Like, as a patient, if you're listening to this, like, you probably are like, that is terrible. I want my doctor to get help 10 steps before that. Not when they're like, I'm almost at the point of cutting off someone's wrong leg, but I didn't do it yet. Like, that's a terrible barrier. And that's sort of like what they wait for because of stigma, because of fear of licensure, because of this sort of like unhealthy bar of what counts. And it just makes it like, so we really wait a long time until we finally do it, or we get forced to do it because we do make that mistake, or we do have something happen. And that's also not when I want people to ask for help too.
Right. And I think your book clearly amplifies it because it's the pandemic. So that whatever emotions were on the surface then become tenfold because you're hearing this over and over. And I think in the book, you really describe that when you talk about the coding over and over and how the nurses and the doctors are supposed to deal with going in every day and getting used to hearing that coding sound over. It's not something you could ever get used to. And I think also when you talk about it's like because of what you do, being a psychiatrist, you're aware of symptoms. But I don't even think doctors necessarily, like physicians, are aware of I'm not sleeping. Oh, must be a mental health. I was running around the kids. I had to tape my, notes, doing all that. Oh, now I can't, my stomach's upset. It must be like you justify the symptoms until you can no longer justify them because you're either in the book you describe the panic attacks, you're either in a panic attack, think you're having a heart attack. Why? It seems like this generation's getting a little better. It seems like the younger students are starting to be able to say, I need a mental health day. But when is it going to be okay in the healthcare system to say, I can't do this today? Like, I need help. Even you had trouble in the book saying that.
Totally. So much trouble. A lot of that for me was like, I just wasn't looking at myself at all. Like, and I had a lot of guilt about how much I wasn't actually a frontline worker. Like, I wasn't in the hospital. So my job was to work really hard and help the people who were. And I was like, overwork makes up for guilt, right? So, I just did that as much as I could. And I think so many of us really do that and not ever like really looking at ourselves in that equation. So it's not just healthcare, obviously, like being a caregiver, being a mom, being like a teacher, being like I could just keep going, but in
Being
a
a
lot of these,
human at this
You're right.
yeah,
point.
being like, there's a lot of things, right? And I think it's important for people to realize like the pandemic didn't like come from the clouds and make us sad. Like it, we weren't great before, and the pandemic gave new stressors, which made things worse. The same is true for college students, who's my other sort of population I see. It's not like they were great before, and that, but they had all these things, and it made it worse. And I think when I look around me as a student, as a healthcare worker, like what I see is people don't sleep, people don't eat, people seem sort of sad and mostly burnt out. And our numbers are over 50%, right? So if you look around, most people you see are burnt out. So then you think, I'm pretty sure that's just what work is. I'm pretty sure that work is overwork, work is not feeling good, work is pushing myself to a limit, and that's what being successful means, and that's what working in this profession means. And then if you start to go, hey, wait, like that's terrible, why is that okay, then you blame yourself, because you're like, everyone else seems to be sad and cutting it, so if I can't cut it and I need to ask for help, or I need to take a break, like maybe I shouldn't be this, or maybe I'm in the wrong field, or maybe I made a mistake, or maybe they didn't know who they were picking, and all this stuff, which really just blames you for an entirely terrible baseline of everyone else, and an entirely like just terrible culture that we work in this country in particular. And I think the newer folks come up like valuing work-life balance a bit more and talking about this more, but it leads to a lot of conflict, with the generation of folks who sort of like made it through, but also the generation of folks who are kind of like me and like in between, where we had to adjust, but we don't love that we did. And we kind of think there's an in between, but it's probably not working at all. And I think that there's some balance that's getting lost in that conversation, where there's like, we deserve work-life balance, which is 100% true, but you're in a profession that is still really hard and has a lot of expectations that aren't changing, and has a lot of system issues that can't change tomorrow. And so as much as you would love to not work on a weekend, no one else is working, so you're still working on the weekend. So I think we are struggling with the transition in this conversation, which is leading to some of the issues around like people just wanting to take the time off, right? Because I think you see like one generation sort of fortifying, like, we show up, this is what we do, we worked hard to get here, we worked to the point where now we're allowed to have flexibility and vacation, we had to go through all that before that, right? And then you have this one coming up saying like, why would I do that, that's terrible, like I want a better workplace than that. And something's got to give, and I don't know what that thing is, but sometimes I worry that medicine's going to have a really hard time recruiting people in that context, because we're a big system behemoth that's not changing tomorrow. And if you really really do value work-life balance, like there are things that we're doing that are better, but you could have a better work-life balance in a lot of other fields. And so I think we have to figure that out some, so that we can compete and still get the same people. I think that there is probably a happy medium between hard work and taking care of yourself that we haven't figured out yet, because the pendulum tends to go woohoo, because you can see that with
Mhm.
all things, like the pendulum just goes like all in one direction, like there's no nuance to anything
Right.
anymore. But this is a very nuanced conversation, because until like there are more people that do a field, if you're the only, your wellness is complicated. Like,
Right.
and I think that we have to try to figure out how to help people do their jobs and work hard in the way that they want to, but also feel like fulfilled, and like they're taking vacation and they're having meaningful lives and they're able to have real lives as humans, and they don't have to lose themselves in it and all of that, without necessarily like being able to wipe clean and start over as a system, because I would
Right.
love us to be able to do that, but it's just not realistic. And I think sometimes when I talk to people in Gen Z, like they're just like, why can't this change tomorrow? Like
Yeah.
this is just
Yeah.
like, this is just the dumbest thing, like why do we do that way, it shouldn't be
Right.
done that way, it changed tomorrow. And I'm like, you don't think anyone's ever thought that before? Like
Yeah.
we'd love it to change tomorrow, it's stuck like that.
Yeah.
Like, and it's sad to have those conversations, and it's like it takes away a bit of their like sort of hope that I
Right.
like kind of love, but it is true.
Yeah, it to me when I was reading your book and what I've heard from friends that are in the medical field, it's like a hazing. I'm like, why do you have to? Hazing was supposed to be done away with in colleges. It, it, why are you hazing these new people that are coming in? And we've talked to other physicians where, especially in the field of gynecology and urology, that's a lot of our guests, where there's going to be a shortage. And women can't see gynecologists in their area, and they're having to travel. And thank goodness there is telehealth for some things. Can't have a telehealth exam, pelvic exam, but it
That
is
would
like
be interesting.
that's okay. I think that's illegal. But I don't think I would see that. But anyway, it is like a hazing to me. And when I was reading your book too, how they rolled back some things, like there was a thing you talked about, the 24-hour on call. And I can't remember exactly why did they take that back? Like, didn't they roll it back?
Yeah, sometimes it's like the data that they have to prove their points, and then like people having strong opinions about one thing or another. So, like, sometimes the data says something like more people didn't die when we had longer hours. And so, what they take from that is, oh, we can keep the long hours instead of like, well, what else is there besides mortality or time in a hospital that should be measuring some of that? Those studies are all like very skewed for lots of reasons that are true too, which is if you report that you work extra hours, your hospital system can get dinged for it. And then you're working at a hospital that gets unaccredited because they're violating duty hours. So those studies are not like people aren't encouraged to be telling the truth of what their actual work environments are. So, I think that's all really hard. But yeah, we roll stuff back all the time if it's gonna help what you want or what you
Wow.
need, and that's a really like, working that long can lead to like basically you're working drunk because that's what not sleeping can do to folks. And that's really, really hard. I luckily wasn't in a program that had that, but I had night float, which was a replacement, where people work for 2 weeks at a time at night. And then so you're sort of tagging someone out. But yeah, I mean, it is hazing in a lot of ways. It's also, the word resident. So the hospital was built on residents existing. It's called resident because they'd sleep in the hospital. Like that's what they're literally residents. And it was built on their backs as a hospital system really can't survive. Like a big academic hospital can't survive without residents. Private hospitals, your little community hospital, if you don't have residents, they figured it out. But the big academic ones with the most like caseloads function entirely on a resident seeing most of the patients and someone supervising, right? Like that's how we've grown to be. And if they're not in the hospital, who's in the hospital? And so it's really, really hard in that way. But I've never really understood like hard work is one thing, hazing's another. And I've never really understood that. We call it mistreatment. And somehow we think that's different than hazing. It's hazing.
It's hazing. Yeah.
But we don't, some specialties are worse than others, maybe in the same reason that like some frats are worse than others, some sororities are worse than others. But um, I've always respected hierarchy in like a knowledge sense, but I've never respected it in a power sense. Like I don't think it's very helpful to exist where I'm up here and you're down here and I know more so I'm better than you, but instead like well like you're supporting me, so how can I support you in supporting me and the rest of the team? Because that's true, right? Like I do know more. Like that's the point. Like I went to more school, I'm done with the school, I've been training longer, I've seen more patients. Like sure, I respect you for knowing more, but I don't respect you for knowing more to the extent that now you can treat me terribly or like embarrass me in front of people or trick me into doing stuff or whatever it is. Like a lot of that stuff is just terrible, or throw things at me. I've seen that happen a
Yeah.
lot. Like that stuff should just not be a thing, right? And so I think it's gotten better as like some of our accrediting bodies have paid more attention to it, but it's subtle. Some of it's really subtle in ways that like they will always get away with. Like a fraternity didn't like make somebody drink so much they like had to go to the hospital, but maybe they almost got there. And it's very simple like that. Like if you're not raising the red flags, you're kind of under the radar, and some of that stuff is still really under the radar. And like people will report the bad people and they still stick around, and that's sort of, it's a bad culture in some places. And I think a lot of work environments probably have bosses like that too, right? Like just how that boss is. I don't know. But like that's just horrible justification for something that could be taught in like leadership coaching and like
Right.
you could get rid of it as like a this is a never thing that we do.
Right.
I think
Exactly.
there's a mentality that if I survived it, I went through it, that you have to go through it. And until that mentality is broken, until people say, no, they don't have to suffer just because we did. It's going to take that to be a part of it because that's going to break it. And then the next generation, it's going to take them saying, you know what, I value more my family life. I value more having a mental health because, like you said, this all goes into your mental health as well. Your physical health is, if your mental health is not strong, your physical health is not going to be strong. And especially in the field of medicine, I don't want a resident who hasn't slept in 48 hours checking me out in the emergency room. Like, who wants that? They don't even remember their own name, let alone be cognitively aware to say, oh, I think you're having a stroke, or, you know what I mean? Like, it's going to come to that point where hopefully the next generation understands that you don't have to work to death. You don't have to, and I think that leads into a topic you had in the book about normal perfectionism versus maladaptive perfectionism. And can you talk about the difference between those two and why it's so important?
Yeah, like a lot of us are perfectionists and it's not bad. And a lot of us would want a doctor who's perfectionist because maybe they won't make mistakes, right? But it's like how do you view those mistakes and how are you incorporating like perfectionism into you? So like normal is like I would like to be really good at things most of the time. If I'm not, I the world is not ending and maybe that's something I could learn from and do better next time. Maladaptive is like, if I make a mistake, I will never make one. There's no way I can make one. How could I possibly ever make a mistake? And if I make a mistake, I'm a terrible person and a failure. And now I have depression, right? Like it goes very quickly into like how that manifests in you as a mental health issue. I mean, if you look at errors in healthcare, especially, super correlated with burnout, with depression, with suicidal thoughts, with anxiety. All of this should not surprise anybody. But it's because there's like this built up belief that like somehow you will never make a mistake. Like that's not possible. But like maladaptive perfectionism is like you are striving for something that is actually impossible, but you think it's possible. So when it doesn't happen the way that you think it's going to happen, you like really blame yourself in a very bad way. And I'm sure like people listening have seen that in their peers and have seen that in themselves too, where you're like, all I did was like not reply to an email. Why am I beating myself up about this so much? Or like, the simplest mistake shouldn't be a 10 out of 10 thing either, right? Like, people write a lot about like what growth mindset, things like that, there's a reason that's helpful, which is that we all do have times where we're not going to get it right, and how somebody who wants to get it right all the time it like is able to process that is where the adaptive maladaptive part comes from, really.
The last point I would bring up is in the book you say that the system is just as broken as the people working in it, which I think really highlights your book in a lot of ways. Do you think a step in the right direction would be for residents, first year doctors to or even ones that have been practicing for 15 years to be required to see a therapist every couple months or once? Would you think that would be a step in the right direction to get them to maybe understand that humanity needs to exist as a part of medicine?
I appreciate you asking that question. There are some places that do something called opt out, which is like when there's a new class of students or when there's a new class of residents, you are automatically given check in appointments with a therapist or a coach, like however they want to define it, like somebody in a wellness role. It might be actual therapy, it might be just to check in. And if it's something, then they'll flag the right people, whatever it is, however they frame it. And it's your job to cancel the appointment. Like you can opt out of it, but they put you into it. And so you can get out of it. In the data on that, people are much less like they stick with it longer. There's more like use to, and there's less stigma. So there's definitely a place for that. And I think it makes a lot of sense. I think it's hard sometimes just sheer volume because you have to think about where all those people are going. If they all chose to go all the time, like that's going to then make it like a pretty significant strain on the system. And you have to kind of think about what it is. I think in that sense, also being mindful that like our hours are terrible, and so like you need after hours, you need weekends, like all of that is true. So you do need a specific kind of person to do some of that. Like some people love working weekends and they don't work during the week, but you have to find those people to be on the list who's doing it. I think it's harder when you get to faculty and staff because there's not like a clear orientation time, right? Like there's not like a clear everyone comes in at once and they all get appointments. Like they'd have to do it when you started the job or something, and it's just less defined. um Anybody who's listening could probably argue that like faculty and staff are often neglected in the conversation, and we spend a ton of time on students and then residents because they are underpaid and you want to help their well-being, but it's also part of like requirements to keep your accreditation and all this stuff. But faculty and staff aren't, and so they're vocally not okay, but they tend to just be given HR benefits. And I think that sometimes those are enough and sometimes they're not. And I think that's worth a conversation as we look to what we change too, because if people think that the only people that matter are the students, then it also creates more of that tension we were talking about. If it's a universally applied thing that we need to be thinking about and working on, then you feel less like you're pit against the person who's allowed to be well when you're not. And I think that matters. But yeah, I mean, I think I often say to people, like, of course, there are huge system changes that would be lovely to make, but most of the things that would make our workplace better are really boring and simple, like being more transparent, being a little bit more vulnerable, and like supporting each other a bit. Meaning and purpose are across the board preventative against things like burnout. Like, what do you like about your day? What don't you like about your day? Do you have any ability to decide that? If you don't, do you have ability to make sure that you're taking care of yourself after all the things you don't like? Like, what does that look like? And I think none of us are really that mindful about like all the things we like and don't like. I think we're just sort of like Mondays are terrible, Tuesdays are okay. I like talking to students, but like we don't really know what that looks like. And I think, another like really just easy step for anybody in a workplace is like, what do you like about your job? What don't you like about your job? Do you have any ability to cancel some of those meetings that you don't like, or move them, or give yourself time for something else? When you're saying yes and no to things, do you ever think about yourself in that equation? Like, have you ever gone, well, do I like that? Not just, am I supposed to do it? Does it look good? Is it on my CV? Like, some of those things might always outweigh, right? If your boss tells you to do something and you have no choice, your boss told you to do it, you're doing it. It just is what it is, right? But sometimes if you're given a couple things and you could say yes or no, like you should probably know why. And you should also not just say no because you're burnt out too, because I do that all the time. I'm like, how dare someone want to be mentored by me right now? I'm a terrible person. And then I'm like, when I'm talking to them, they have so much more like hope and enthusiasm, and it's like contagious because you're like, oh yeah, like there's good stuff about my job, and like I just forgot until they mentioned it to me, right? And so being really mindful that like some of this stuff sounds so stupid. Like you're like, Jessi, the answer to a very broken healthcare system is not being a little vulnerable and finding meaning, but like it really oddly is. And like I would love to change some of the system stuff, and like someone needs to do that, and like I'm in a role where I'm working to do that in some capacity, but not all of us, like day to day, all of us need to help each other and ourselves, and like be mindful that that doesn't mean that we're saying like you're the problem, but we're kind of saying like, please don't quit, and like please figure out like what works, and please like recognize that people like it when you're human and patients like it when you are, and like find that. And it's okay if you're like, if you react to something or you feel something or whatever, you talk about it. It matters.
Thank you so much, Dr. Gold. Make sure everybody checks out How Do You Feel? One Doctor Search for Humanity in Medicine. We will have it in the show notes, and we appreciate so much this conversation. I think it's going to help a lot of people.
Yeah, thank you so much for wanting to have it and having me come.